Talking, yawning, and most importantly chewing are the main actions of the temporomandibular joint, often referred to as the TMJ. The TMJ is the point between the temporal bone of the skull and the mandible, hence the name temporomandibular joint. It is a bilateral joint, meaning that there is one on each lateral side of the skull. The TMJ is classified structurally as a synovial joint, meaning it is comprised of a joint cavity, ligaments, and an articular capsule. It is functionally diarthrotic, meaning it is a freely movable joint. The mandible is the movable bone of the joint. There are 6 types of synovial joints, and the TMJ is classified as 2 of them. A hinge type called ginglymus that allows uniaxial movement, and a plane type called arthrodial that allows side-to-side movement. Therefore, the temporomandibular joint is technically classified as ginglymo-arthrodial. The components associated with the temporomandibular joint on the mandible include the mandibular condyle to the posterior, followed inferiorly and externally by the mandibular angle and ramus. The components associated with the TMJ on the temporal bone include the mandibular or glenoid fossa, the zygomatic process, and the styloid process. The primary articulation of the TMJ is between the mandibular condyle of the mandible and the mandibular fossa of the temporal bone, as seen here. The joint has 3 ligaments holding it together. Laterally, the temporomandibular ligament extends from the zygomatic process of the temporal bone to the lateral surface of the mandibular condyle. Internally, the sphenomandibular ligament extends from the spine of the sphenoid bone to the interior surface of the mandible near the mandibular foramen. Also internally, the stylomandibular ligament extends from the styloid process to the posterior surface of the ramus and mandibular angle. The temporomandibular joint's articular capsule attaches and encapsulates the mandibular fossa and the mandibular condyle. A special feature of the TMJ's articular capsule is that the capsule also contains an articular disc composed of fibrocartilaginous tissue that essentially divides the cavity into 2, an upper and a lower joint cavity. Inside each capsule, the joint cavity contains the synovial fluid produced by the synovial membrane. There are 4 muscles that control the TMJ. All muscles receive their blood supply from the maxillary artery and are innervated by the mandibular division of the trigeminal nerve. Keep in mind that there are 2 temporomandibular joints, and therefore there are doubles of all of these muscles. 1 set for the left TMJ and 1 set for the right TMJ. The masseter originates on the zygomatic arch and inserts on the angle and ramus of the mandible. This is the main muscle for chewing or mastication. When the masseter contracts, the mandible is elevated. When it relaxes, the mandible is slightly lowered or depressed by its own weight. There are 2 muscles on the interior surface of the TMJ. The medial pterygoid is a synergist to the masseter during mastication, helping to elevate the mandible. Working with the medial pterygoid, the lateral pterygoid protrudes the jaw or glides it anteriorly and assists with the jaw's grinding motion. The temporalis is located on the outside of the temporal bone and is the largest of the TMJ's muscles. The temporalis is a convergent muscle or fan-shaped. This allows for more than one action or movement, including elevation, protrusion, and retraction, or gliding posteriorly of the mandible. Mandibular protrusion creates an underbite, while mandibular retraction creates an overbite. The grinding motion of the jaw is created by the medial and lateral pterygoid muscles contracting unilaterally. When the left muscles contract, the left mandibular condyle glides anteriorly, while the right side stays in place. Alternating unilateral contractions appear to make the mandible slide from side to side, when in reality the actual movement is an alternating unilateral protrusion. Dislocation of the temporomandibular joint can happen in 4 ways: anteriorly, posteriorly, superiorly, and laterally. Trismus, or lockjaw, is a sustained contraction or spasm of the masseter that can have a number of potential causes, but is seen many times in cases of tetanus. Disc displacement is the most common TMJ disorder. This is a displacement of the articular disc in the articular capsule. This causes pain and possible click or pop sounds during movement. Many other problems with muscles, ligaments, and other tissues of the temporomandibular joint are collectively referred to as temporomandibular joint disorder, or TMD. Many people commonly misuse the acronym TMJ when they actually mean TMD. This video was prepared as part of the course requirements of Human Anatomy at Saddleback College.